Well, I think we got an interview coming up with David Price with previously with the Kansas City Chiefs.
Yeah, he's got a 30-plus year career in pro football. So
that's not terrible.
That doesn't suck. That'd be a fun job to have as an athlete.
What was he, athletic director?
Athletic trainer.
Trainer.
Yeah,
athletic
so he's
trainer.
a head trainer.
I'm curious what his take is on. He's obviously a fan of the product.
Yeah, he's seen some injuries in his time, I'm sure. Looking forward to hearing what kind of injuries he's seen and how he's treated them over the past. And then also, man, what could he have done having this product in the NFL 20 years ago?
Totally.
10 years ago.
I hope he's kind of talk a little bit about opiates and what the challenges are around there, because I think a misperception people have around opiates is that they are bad, all in all bad. They're not.
It's a good point to make, yeah.
They're a useful drug
Yeah.
under certain conditions. It's just they get from, at least I'd have to say from my opinion, they've been expanded out too broadly in application.
Yeah, they have risks that the longer you're on it and the larger the supply that you're given in your initial prescription, your risk of addiction increases tremendously.
Yep.
But short term, dentists, they need to be prescribing some opiates.
Man. You ever have a tooth pull,
dental
especially
pain's
wisdom
not fun.
teeth?
Yeah.
Dude, that's not pleasant.
Yeah.
Or, acute accident, pain type stuff. Man, I know
Absolutely.
I broke both my collarbones. So I woke up on a morphine drip. I was like,
Was that a ping pong accident?
it was.
Yeah.
It was tragic.
Yeah.
So these things happen, man. All right, well, I think we should try to get David a call, kind of go from there and see what he's got to say about
All right,
stuff.
let's do it.
My 32 years in the NFL, I didn't have a job without the players, because they were the owners may think they're the commodity, but to me they were my lifeblood. So I took care of them, like they were my own. It kind of segued when I started using your product, that it fell in the way I treated myself and the way I treat people that use topicals and try to get away from the medication and taking the pills that most people utilize. Just taking narcotics, that may take care of the pain, but it doesn't do anything for the inflammation that causes the pain. So we would always try to reduce the pain, and that's where, using Myaderm, what I found was, I use it on myself, whether it's my knee or my back, or elbow or shoulder, wherever you wanted to use it, that it fights the inflammation, which controls that, and then takes away the pain in turn. But how much transdermally really actually goes into the blood system opposed to working on that specific area that you're on?
Yeah, that's a great question. Absolutely. Using transdermal technology, you do get absorption into across the skin and into the muscles, and it does get into the bloodstream. So, you're talking close to 100% of the dose that you apply does get into the bloodstream. And if you're using the THC product and you are tested for marijuana, you'll test positive. Absolutely, no question about it.
Now, it's just something people have to understand. But like I said, when it comes to myself, and most of the time, what I found, the people that utilize the product in my area, I found that they're basically at wit's end. In other words, they've taken all the narcotics and nothing has helped. I mean, absolutely nothing has helped. So as an option, they're willing to try anything, and they're not usually at the age of 45 or 50 years old. Most of the people that I'm working with or deal with, there's no issues with them getting drug tested. They're not working at that time, or they're not under that stringent ruling. That I found that it worked amazing on elbow tendonitis, tennis elbow, carpal tunnel, fingers. We had a woman with chronic and arthritis rheumatoid arthritis that could never bend her fingers, and utilized it on her knuckles. And within 10 minutes, she was like, that's the first time she's been able to move her knuckles without any pain in her fingers. And people, like I said, people with elbow tendonitis or impingement syndrome in their shoulders have all reported to me that they had great results. And it was almost within 5 minutes of working. So you definitely have something that in the right setting for people that want to utilize it, it definitely works.
The biggest group that we're attracting right now are those early adopters who are kind of at the end of the rope. They've tried everything out there and they're like, I got to find something that works. I got to find something I can use daily. It's not going to have a negative impact on my body, which both of our products classes, whether it's the THC or just the CBD product, are very safe and you're able to use on a daily basis without having any negative impacts on your body. And the CBD, because it's industrial hemp derived, you don't have to worry about drug testing. You don't have to worry about having any type of scenario where it's a risk of any sort.
I found that people weren't even opposed to the THC when they used it, because they were at that point of their life where they were that much discomfort, getting ready for surgery, going through cortisone injections, and none of that helps. But it's almost within 1 or 2 treatments that they noticed relief. And I think the other component people don't realize is a lot of times with pain and inflammation, you then stop working out, or if it's your shoulder or your elbow, you don't use your arm very much, so you can't go through any maintenance exercises, so you get weaker, so you get more painful. So what this product would allow you to do is continue to get back into your maintenance programs, rehab programs if you're under a care of a doctor, and safely build more muscle, which will then in turn take away the pain that you had, because you're getting stronger, more supportive area around the injury or the overuse syndromes. This product, to me, it bridges that, and then in turn you can get back working out, and let's get rid of the problem rather than just maintaining it all the time and having to deal with it the rest of your life. There hasn't been really one person that I've utilized it on that hasn't had results. The majority of the people are head and shoulders like, listen, you got to get me that product. I mean, it made that much of an impact. And I mean, like I said, people that I've had cortisone shots, I had everything and nothing helps. And ready for surgery, I'm like, listen, just give this a chance. I said, just try it, see what you think. And this is unbelievable. I haven't taken an anti-inflammatory, I haven't taken a painkiller, I haven't taken anything. I mean, it's ridiculous to see what's happening out there, but it's just, you got to change the culture, the way people think about medications. But there really wasn't a lot of alternatives. That's why we use so many topicals, because I really didn't want to go with, I didn't let players play with narcotics in their system, giving it to them, because that just wasn't our philosophy. We didn't give guys Percocet or Vicodin, here's a couple Vicodin to play. Now, it just wasn't the way we operated.
That's good to hear, man.
Yeah. I mean, it's not the same everywhere, but you know what? That's just the way I sleep and breathe, but a lot of other people don't. And there's people out there that they just live on the things, and because they don't know there's an option of this to have. So I think you got something that's really good, and not only an alternative, but something to that you can use, whatever comes up. Because if you take painkillers, you got a 1 in 10% chance of getting addicted. That's the last study I saw. So if you got a 10% chance when you get that prescription after shoulder surgery, a Percocet, you got a 10% chance, the way your body's made up, to getting addicted. I think I'd want an option.
Even if it's not causing an intoxicant effect and it's not causing you to feel high, it's still there. You're still going to test positive. It's like being kind of pregnant. You either have it or you don't. You're either pregnant or you're not. You either have THC in your system or you don't. And the drug testing, the lower level that they test for is so small that it doesn't matter if you're going to test positive whether you feel high or not.
Right.
And 3 days later you can still test positive when it's such a small amount in your system that it's really not even having any activity, but you'll still
I'll tell
test
you,
positive.
any person that I have utilized the product on, none of them have brought that up because they could care less because they're in such pain.
Yeah.
Discomfort that I don't give a shit. All they care about is, listen, I don't want to be stoned. I don't want to put it on before I go out golfing and then freaking, be loopy after drinking a beer. I'm like,
Or driving. I mean, that's a serious concern, right? So whether you're taking opiates or THC products or anything that could impair your abilities, that's serious consideration.
Yeah.
no, but I think it's awesome. I mean, because to give that alternative, that you have that type of alternative, it's a home run to me. I mean, I can't see. And there is so many people just based on not wanting to take pills. It's a home run because I don't want to take pills. I want to take the Vicodin. Give me an option.
Right.
Yeah, and I think when you're throwing those other two, the edibles or troches or smoking, you're going right into your blood system, whereas this is going to an injury first and then the blood system. I would just like to know, like, of that 10 milligrams, 10 milligrams that I ingest is straight 10 milligrams. There's no way about it. It's going to get metabolized and broken down, but it's still 10 milligrams. If you're putting it topically, is it really?
I can say with a relatively high degree of certainty based on all our field tests that the percentage that gets into the bloodstream and passes the blood-brain barrier when you apply it transdermally versus smoking or eating is a small fraction.
Right.
10 milligrams applied locally through a transdermal, a small fraction is going to cross the blood-brain barrier.
Right.
If you smoke it or eat it, a very high percentage is going to pass the blood-brain barrier. So the problem with those delivery systems is you are absolutely committed to the intoxicant effect. You can't, if you're using THC, you can't get away from it. The only way to get away from it currently is to use it transdermally. The most surprising thing about David was just how direct he was on everything. I did not see that coming. I didn't think he'd be as direct about specifically like opiates and how they having alternatives is going to make a difference for a lot of people, which we talk about all the time. But it's tough for people who are in an industry where you got to have those kind of drugs because people don't get paid.
NFL went through a rough time.
I think they still are.
Not too many years ago with opiates,
Yeah.
So.
And we saw it too in the compounding. I mean, daggum, like 1,000 pumps a day at one point, I think, is what we were moving.
Oh, 1,000 bottles of basically 1,000 bottles of pain cream.
And those were not cheap, dude.
And they're not cheap, but they're also considered an alternative to opiates. So that goes to show you what the how many people out there are actually looking for alternatives to opiates. And
man, it's hit. I got family who's battled with opiate.
Yeah.
Because they've had 7 surgeries. You got severe pain after that. What do you do to battle that? Prescribers generally go straight to opiates because that's going to stop the pain.
Yeah.
But there's a side effect to that.
Yeah.
Besides just the high effect, you get a high potential for addiction. I know David threw out a 10%. I'm thinking that's a little conservative. What do you think?
1 in 10. There was a study released. I believe it was around March, just a few months ago, and it did show that. I'm going off memory here, but I believe it was. If you were prescribed a certain amount, say a 3 days supply of opiates, you had a 10% chance of being on opiates for at least a year.
That's pretty grim.
If you were prescribed a 5-day program, you had a 15% chance. And it was a huge correlation depending on what your initial supply was because you're likely going to go through those. And the
So
longer
10%
you're on
is the
opiates,
baseline.
Right.
I mean, bottom. Well, that's, it's a tough point to discuss how to combat that scenario because people need it. There are people in severe enough pain where they need
Right.
opiates. It's a valid drug, but they need alternatives, and they need either a capacity to try something before it or to segue to it.
Well, and that's an interesting point because most of the time you're not given a choice. Okay, do you want to be on an opiate or do you want to try something else?
Mm-hmm.
It's you're in a car crash and you're in the hospital and you're on morphine in the hospital.
Yep.
And to transition somebody off of that it's not easy. I mean, it happens all the time. People are transitioned off of morphine, but usually they're transitioned off of morphine by being given Vicodin or Percocet.
Which isn't really a transition.
It is.
so to speak.
It's like coming down off of heroin by using methadone. Well, you're just changing the addiction to another product that's supposedly less harmful, and that's one of the things is that people have to have an option on how to get off of opiates because sometimes being put on opiates is not a choice they make.
Right.
It's just something that happens to them.
Doctor takes control of the situation.
Or they don't realize how.
Or they're in the hospital, yeah.
Or they don't realize how dangerous it is and how easily it is to become addicted to it. You hear about it all the time. We do. We're in the, and we're around healthcare providers all the time. We have our ears to the ground when it comes to that. But the general population doesn't necessarily pay attention to that.
Yeah.
They hear opiates are bad. Well, I'm glad I don't take any opiates. I only take, hydromorphone.
Uh-oh.
I only take Dilaudid. I'm not taking any of those
no.
opiates. I don't
Oh,
take
forget
morphine. I
that.
stay away from morphine and oxys all day long. And so they just don't realize it, and they don't realize how easy it is to become addicted to an opiate. And so once you're addicted, then what do? How do I get off of this? I try to take less of them because
That's
I
the
know
worst part of this whole
because
thing.
I know
The
I
worst
shouldn't be
part of it.
taking this many
Yeah.
of them, but I hurt.
Yeah.
And I'm in pain, and I need some way to get off of them.
Yeah.
And it's so easy just to say, okay, just this one time I'm going to take an extra one. But then it happens, the next day, I just have to take an extra one today. And it's really, really hard to kick an opiate addiction.
Yeah, dude, throwing that, pain is a stimulant to get something to solve it because you don't like it, you want to stop it. And then you layer on that addiction, which seems to have a compounding probability as you move down weeks. Man, that's a tough one.
I had a professor in pharmacy school. I remember he described pain. He said pain can easily be described as an opiate deficiency in the body.
Dang.
Yeah. Yeah.
That's even grimmer.
And
Wow.
and this was 15 to 20 years ago that I heard him say that.
Man, you're getting old.
Yeah, thanks. I went to pharmacy school when I was 12.
Okay,
Yeah.
fair enough. When you were part of starting up Walgreens compounding division, was it around pain creams? What was the driver on
No, it was hormone replacement. It was primary hormone replacement and children's medications. We had the Children's Hospital right up the road. We were associated with, and
Okay, because they needed doses that weren't
children
available
need
through.
children need dosage and drugs that aren't
delivery
available
systems.
in those dosage forms. Yeah,
Did you guys do any pain cream stuff?
very little.
So
Yeah.
okay,
There were a
really
few
not.
here and there.
Then you moved to compounding as more focused on the pain cream.
Yeah. Once
Still a
you
lot
get
of
into an
hormone,
independent compounding pharmacies, they were focusing on hormone, thyroid replacement, and veterinary medicine as well. But pain creams by far became the driver of that business.
Hey, speaking of that, we got Myaderm Pet coming out.
Yeah.
You were the first not test subject, first test case with your dog.
Yeah,
on
Zoe.
it. So what happened with Zoe?
Our little Cavalier poodle mix and a little Cavapoo. She had a sprained shoulder or just a hurt shoulder. We weren't sure what exactly it was, and she'd been limping around for maybe 3 days, and I happened to have a bottle of Myaderm sitting there. Weird, I know. And my wife just reached over and grabbed it and rubbed it on her shoulder, and I was like, I never thought of that. Never thought of putting it on my dog. And literally within a minute, she stops limping. And dogs don't have a placebo effect. They don't. Not that I know of. Animals don't have placebo effects.
Well, yours may be really smart.
Yeah,
I don't
really
know.
smart
I don't know.
dog. But it was really interesting. And she walked around and ran around and jumped up on the couches and jumping down and no problems.
Did you try to lick it off?
No, she did not. No, it was we put it kind of in her armpit anyway, but
Okay.
it doesn't taste great, so dogs aren't gonna try and lick it off. It's not like it's something good.
What if they do?
If they're if it's on a hind leg or something, you can actually rub it into their ear, but into the flap of the ear if you want. The good thing is if you put it on a hip or back leg, a quarter, anywhere they can reach, it absorbs in so fast.
Okay.
It's not like an ointment where it just sits there and then they can lick it off and they don't get the effect of the medication. I mean, Myaderm absorbs in super fast within 15 to 20 seconds.
What if it's like a Saint Bernard? Big old hairy beast.
Yeah, you can get it down into the skin. It's
Just
not
kind
a
of
problem.
pull it apart.
Yeah.
Okay.
You wouldn't, it's like shampooing. You wouldn't understand.
I have no
but
understanding what you're talking about.
you can still get shampoo down to your scalp.
Okay. I've heard rumors of this, but I have no personal experience with that.
Yeah.
Okay. Well, I think I think our biggest challenge is education, helping people understand what CBD is. They know what THC is because they hear about marijuana all the time, and they think it's the gateway drug to everything else. And then understanding what transdermal is, through the skin. Even that's a tough one, but we're starting to make some progress. Certainly having David sit here and tell us about how great it is for him, all the folks he knows that he's given it to, and what a great option it would have been back in the day if he was treating athletes. I mean, that'd be fantastic. I'd love to see that option become available because I think we can help a lot of people, and certainly athletes are getting beat up all the time. They're a great candidate.
Yeah, that's not going to stop.
No, it might be intensifying a little bit.
Pain and inflammation in the NFL is not going away.
All right. Man, I guess that's going to do us for today.
All right.
So
it's a wrap.
Until next time.
All right.